Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why your bladder is suddenly so weak. Bladder emptying relies on coordination between the kidneys, muscle contractions, and nerve signals. If something goes wrong with any of these, an overactive bladder can occur. /r/n/r/n Up to 30% of men and 40% of women in the United States live with symptoms of overactive bladder. /r/n/r/nSrdjanPav, Getty Imagesrnrn Overactive bladder can happen as a result of poor communication between nerve signals in the bladder and brain, with the brain signaling to the bladder to empty even when not full. It can also happen when the bladder muscles are too active and contract to pass urine before the bladder is full, causing a sudden, strong urge to urinate. /r/n/r/n Bladder control problems, such as overactive bladder symptoms and urinary incontinence, can have a number of causes. /r/n/r/n Risk factors and factors that can contribute to overactive bladder may include /r/n/r/n Bladder muscles and nerves can be damaged or affected by conditions such as /r/n/r/n Many conditions can have symptoms similar to overactive bladder. If you are experiencing symptoms of overactive bladder, talk to your healthcare provider to ensure an accurate diagnosis. /r/n/r/n In some cases, overactive bladder may be caused by medications such as /r/n/r/n The Urology Care Foundation offers an overactive bladder assessment tool that could help you identify your symptoms. This tool is not a replacement for an evaluation from a healthcare provider. /r/n/r/n Overactive bladder syndrome can be described as urinary urgency, with or without urgency incontinence, usually with increased frequency during daytime and nighttime, and without the presence of infection or other abnormalities. /r/n/r/n Overactive bladder with urge incontinence is called overactive bladderdry, and accounts for about 2/3 of people with overactive bladder. Overactive bladder with urge incontinence is called overactive bladderwet. /r/n/r/n Symptoms of overactive bladder may include /r/n/r/n Overactive bladder shares several symptoms with bladder pain syndrome, interstitial cystitis, but overactive bladder does not have bladder and/or pelvic pain or dyspareunia, pain associated with sexual intercourse, like bladder pain syndrome does. /r/n/r/n Similarly, bladder endometriosis and uterine fibroids share symptoms with overactive bladder, but also have symptoms such as pelvic and/or back pain and pain with urination, which are not features of overactive bladder. /r/n/r/n If you are experiencing pain, or other symptoms, let your healthcare provider know. /r/n/r/n See your healthcare provider if you have signs of overactive bladder, or other symptoms of bladder problems. Symptoms of a problem with the bladder may include /r/n/r/n Go to the emergency room right away if you have signs of spinal cord damage, such as /r/n/r/n While less likely than causes such as overactive bladder, changes in urination can be an indication of bladder cancer. Symptoms of bladder cancer may include /r/n/r/n Larger bladder cancers or those that have spread to other parts of the body may cause other symptoms, such as /r/n/r/n See your healthcare provider if you have any questions or concerns. /r/n/r/n Urge incontinence can cause urination during sex, called squirting, particularly at orgasm. /r/n/r/n The fluid released during squirting is believed to originate from the bladder, and has been shown in studies to be mainly urine, but has also been found to contain fluid from the Skenes gland, sometimes called the female prostate. /r/n/r/n Researchers are still working to better understand why and how squirting happens. /r/n/r/n Practicing what are known as quick flicks is a way to help lessen the urgent need to urinate. When you get the sudden urge, squeeze and release your pelvic floor muscle several times in a row as quickly as you can. /r/n/r/n This can help tell your nervous system to send a message to your bladder to stop contracting, and lessen the urge to urinate. It is particularly helpful if you can relax, be still, and concentrate on the exercise when you do it. It may not completely get rid of the urge, but it might buy you enough time to get to the toilet. /r/n/r/n Other things that may help include /r/n/r/n Your first point of care may be your primary care practitioner, a nurse practitioner, or a physician assistant. /r/n/r/n Your healthcare provider may decide to refer you to a specialist, depending on your symptoms, history, and needs. These might include /r/n/r/n Treatment for overactive bladder often starts with conservative measures such as lifestyle changes. Your healthcare provider may suggest /r/n/r/n Pelvic floor muscle exercises can strengthen the muscles that control urine flow and help reduce leaks. /r/n/r/n A physical therapist can help with pelvic floor muscle exercises. Biofeedback, uses computer graphs and sounds to monitor muscle movement, may help with learning how your pelvic muscles move and how strong they are. /r/n/r/n You can also do some exercises at home, making sure you are doing them properly. /r/n/r/n Kegels are a helpful pelvic floor exercise. It helps to lie down when you are first learning how to do Kegels. /r/n/r/n To do Kegels, /r/n/r/n Once you have the hang of doing Kegels, you can do them sitting or standing, and you can practice them while you are doing other activities, such as sitting at your desk, doing chores, or waiting in line. To not weaken the pelvic floor exercises over time, do not do Kegels while urinating. /r/n/r/n Some people see symptom improvement with Kegels and some don't. It may take 4 to 6 weeks before you start to see a positive difference in your symptoms. Keep doing the exercises, even if symptoms improve. /r/n/r/n Medications that your healthcare provider may prescribe for overactive bladder include /r/n/r/n Procedures your healthcare provider may suggest for overactive bladder include /r/n/r/n Surgical options your healthcare provider may suggest to help overactive bladder include /r/n/r/n These surgeries carry significant risks and are only offered when no other options are appropriate or effective. /r/n/r/n Overactive bladder can cause frequent urination and strong sudden urges to urinate, even when the bladder is not full. /r/n/r/n It can be caused by factors such as communication problems between the brain and the bladder, or by bladder muscles that are too active and contract more than they should. /r/n/r/n Overactive bladder is typically managed with conservative measures such as reducing triggers, bladder training, and pelvic floor exercises. Occasionally, more extensive measures are needed, such as medications or surgery. /r/n/r/n Talk to your healthcare provider if you have symptoms of overactive bladder. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.